Well, it is finally starting to feel a little bit more like May out there with those temperatures Dylan was talking about. And that brings me to my next guest. Joining us to talk a lot about the important message in the month of May, Stroke Awareness Month. And it's something that we all kind of need to pay attention to in ways that I think maybe a lot of us don't think about. This is Chrissy. She is from the American Heart Association, and Dr. Manchak with Sanford, a neurologist, talking to us a little bit about what are some people missing about stroke awareness. I'm thinking probably the signs you may not realize.
Yeah, the signs and symptoms are probably the best thing we want people to recognize, because getting to the hospital in a timely manner is the best way that we can provide them the care that we need to give them, and that is very time-dependent care.
Yeah.
So we ask people to remember the acronym B FAST.
Okay.
So the B would be sudden onset of balance issues, so feeling off balance, feeling like the world is moving and you're not, your head is spinning, that type of thing.
Oh.
E would be eyes, so if you have sudden loss of vision in one or both eyes. F is face, so if you notice that your face is drooping down, or if you smile or move your face and one side looks different than the other. The A would be for arm, so weakness in one of your arms, and leg goes in with that too, but it doesn't fit nicely into the acronym.
Sure.
S is for speech. Speech is slurred speech or any trouble getting words out or understanding people talking to you. And then T is time, time to call 911, because again, we need you to get to the hospital as fast as possible so we have the best chance of treating you.
Right. So we were talking a little bit off camera about timing on this, and you guys said that actually we're almost, it seems like, coming out of one of the highest risk times, that time change deal. What is going on with that, Chrissy?
Well, one of the things we know is that sleep is increasingly important to your overall health and well-being. So we include sleep in life's essential 8. So the 8 things you can do to reduce your risk of stroke.
Yeah.
So if you're getting enough sleep at night, that kind of goes hand in hand with getting exercise, moving more, eating a heart-healthy diet, not using tobacco products, and then managing those kind of blood risk factors that we look at, things like blood pressure, cholesterol, and also blood glucose.
Right.
So if you're managing those 8 things, typically you're significantly reducing your risk of stroke.
Right, but the time change can be tricky when we do the spring forward, fall back thing, because that often messes with our sleep cycles, and you said that can increase your risk.
Yeah.
What other things do you see from people coming in with, adverse recovery times from stroke?
Well, I think that overall we're trying to keep, out of 800,000 strokes per year, about a quarter of those are second strokes.
Oh, wow.
So as long as we aggressively manage all of your known risk factors, we're trying to keep that quarter of the 800,000 number down as best as possible. So it's really important to work closely with your regular doctors about all the risk factors that are modifiable, because about 80% of strokes are preventable by doing the things that we can do for ourselves. I want to see you guys in the grocery store, not in the hospital. So if you manage your blood pressure, your sugar, your sleep apnea, lifestyle modifications like smoking and healthy eating, exercise, all of those things, so that you don't have that second stroke. And then unfortunately, if you do have that stroke, as long as you're getting, and we try to do the best that we can for our patients, getting early, often and aggressive physical therapy, rehabilitation therapy for your strokes, that's the best way to recover from them or prevent them from happening.
Right, but those little preventative steps really add up. All right, Chrissy Meyer with the American Heart Association and Dr. Manchak from Sanford Neurology, thanks so much for being here. We've got to wrap it up. There's a lot more we can talk about, and we'll have lots more information for you guys on our website for Stroke Awareness Month all through May. So that will be on after the show, and don't forget about the weather. We're going to check right after.